Coming to the challenges of this CAR T-cell treatment in children, it starts with, is it possible to collect enough cells, lymphocytes, which is not always an easy procedure if a patient received a lot of chemotherapy and perhaps is a short time after allogeneic stem cell transplantation. So it might happen that the collection of lymphocytes is not sufficient enough to get the cells transduced. If this is possible, these collected lymphocytes go to the production site, and approximately 4 to 8 weeks later, the product with the transduced T cells, which are now focusing CD19 positive cells, can be reinfused. In the meantime, it is important that the patient is in a stable position and situation, and it is also important to control infections before these cells are infused, because in the presence, especially of viral infections, it could happen that severe side effects during and after the infusion of the CAR T cells could occur. For instance, a tremendously dangerous cytokine release syndrome, but also neurological effects could bring a patient into life-threatening situations. If the infusion is successful and the patient goes into remission, the chance for cure is approximately 40 to 50% for those patients who became negative before infusion, as MRD negative before infusion of the CAR T cells. For us, it is very important to recognize what happens after the patient went into remission, especially the first 6 months are essential and crucial for the success of the infused CAR T cells. For instance, we had to learn that those patients who have a rapid expansion of the CAR T cells and high peak levels of the genetically modified cells have a better chance to stay in remission than those patients who have delayed engraftment of the transduced T cells. Then it is important to know what happens with the immune system of a patient who received CAR T cells. No number of healthy B cells will be circulating as long as a patient is in remission, and that is especially important for children and young adults because they cannot undergo vaccination. And immunoglobulin substitution is also recommended in case patients experience infection or even as a prophylactic treatment. It is a new possibility to bring patients who had a lot of toxic chemotherapy and perhaps an allogeneic stem cell transplantation to control leukemia. We now have a separate and also very powerful tool to control at the moment CD19 positive leukemia, but many trials are underway to focus and target not only CD19 cells, but also myeloid malignancies, and hopefully in the future also solid tumors. I thank all my colleagues for the great collaboration we experienced over the last years, and we will be happy to see new studies which are not only launched in China and in the United States, but also in Europe. Thank you so much.